I'm excited to be with sheriffs from all across North Carolina today. When you talk about sheriffs, there's usually not an issue that you can think of that they aren't involved with in some way. One of the things I know is that after 9/11 and the threat of terrorism became real on our shores, we saw law enforcement coming together at a local, state, federal level that has carried over to all other kinds of efforts that we have been fighting, from making sure that our schools are safe to fighting the opioid crisis. And we know that working together is just critical to making sure that our people are safe in North Carolina. We're working to make sure that all of the school safety plans are in a place in Raleigh at the Department of Public Safety, so that the floor plans and everything that we need to do in the event of a school disaster, people know where to go, they know what the plan is, and they can work in a coordinated way. But we're all hoping that we can work to prevent such a shooting from happening. I proposed in my budget more funding for school counselors, for school nurses, for people to help with students and their mental health issues. General Assembly did not approve it. We think that we definitely need more help. And one of the ways I'm going to discuss with law enforcement today, they're often on the front line of mental health issues and substance use disorder issues. A lot of the people who end up sitting in their jail really need mental health treatment, and we don't need to expend money to keep them in a jail cell where they're not getting the kind of treatment that they need. So one of the ways that can help, particularly our rural counties in eastern North Carolina, would be to accept Medicaid expansion, because we know that that could provide us coverage for about 600,000 people with tax money that we've already paid to Washington that other states are getting. I've figured out a way for our hospital CEOs are going to be willing to take care of the state's 10%. So this is a way to create rural healthcare jobs to cover people who may not otherwise be covered, and to get some mental health to people who really need it.